We are trying to regenerate a craniofacial bone that is affected by several conditions, including periodontal disease and trauma. So we are trying to look for new ways of regenerating bone. I initially started to work on metformin based on a 2005 paper from Europe showing that diabetic patients taking different anti-diabetic drugs, the insulin, metformin, the ones who took metformin were having less diagnosis of cancer, or if they had cancer, their prognosis was much better. For metformin to work, it needs to get into the cells through a transporter. And I end up looking at different stem cells, especially from the bone marrow and the dental pulp from wisdom teeth, and they also express this transporter. And that sparked the idea of trying to use metformin in bone regeneration. Metformin induces, once it gets into the cells, it induces the expression of different genes that we know are involved in osteogenesis or odontogenesis, which is the formation of dentin within teeth. And that's how we have found that these genes, once you treat these cells with metformin, with doses that are physiologically compatible with what a diabetic patient takes by mouth, it will induce gene expression associated with bone formation. So when there is a bone defect, there are several ways of approaching this. You can use materials that are inert, like different types of cements, for instance, calcium phosphate cements. You can use bone or cells from the same patient. That's an autogenous approach. And also you can use, in this case, cell transplantation in combination with, like we are proposing, with calcium phosphate, cement, and hydrogels. So there are different approaches. They all have benefits, they all have disadvantages, and they all have different costs as well. I believe that the most important advantage of metformin is cost. It's very affordable. So we have currently osteogenic factors, commercially available osteogenic factors that are extremely pricey. Metformin, which is used by more than 120 million people worldwide as the #1 anti-diabetic drug for type 2 diabetes, is very affordable. Metformin has been around for years. It was approved in Europe in 1950. It was approved by the FDA here in 1995 for its use as a glucose-lowering agent in type 2 diabetes. It's been very safe for many years. It's very affordable, and I want to stress that also. And is the #1, the first-line anti-diabetic drug currently in the world. So repurposing a drug that you already know that has been successful in other conditions, not related to the one that we are dealing now, but you know that pharmacology is known, toxicity is known, and affordability is known. To me, that's the perfect combination for trying to push this towards craniofacial or mineralized tissue regeneration, including bone and dentin in teeth.